Good morning. So this video is another gentle one. So the idea is to create blood flow and lymph flow to the pelvic area, and to also connect with your core to build upon for strength and conditioning. So it's predominantly for people who suffer with endometriosis adenomyosis postpartum. So if you're kind of 6 weeks postpartum and you're looking to build strength again, it's a really good way of sort of starting off gentle, really connecting with your core, making sure that that pelvic floor is nice and relaxed in order to build upon those foundations. If you are a sufferer of adenomyosis, endometriosis, and you're at that sort of stage in your cycle where it's becoming painful and you want to find ways to downregulate the nervous system and just get the kind of blood flow moving and to release that painful tension, this is definitely the video for you. We will need a few bits of equipment. So a band, it can be any band. You can buy those cut off ones and just tie it around your thighs, or a rolled up towel and a soft ball or a rolled up towel. So we're going to start in a lying position. You can have your towel or bolster underneath your knees. I've got one underneath my head as well. And then we're going to pop the band around our thighs just so it's ready there throughout the video so it doesn't disrupt the flow. Get yourself nice and comfortable. We're going to have our hands on the kind of lower aspect of our ribs, and you can close your eyes, have your chin pointed down slightly. So just try and relax. We're going to inhale through the nose. We're going to send that breath down like a wave down into the pelvic area. I'm going to allow it to expand 360 into the ribs, and then just release that tension with your exhale. So inhale, feel the ribs expand. Feel it coming into the pelvic area around the back where we hold all of that tension. And then like a wave, we're going to exhale and just release. And again, in your own time, just flowing through that wave. Inhale, expanding into the ribs. Exhale, releasing that tension. Inhale. And exhale. Just do it at a speed that works for you. If you really want to downregulate the nervous system, you can do a gentle hold at the end of each exhale. Really trying to relax the pelvic floor, the lower back. Releasing the tension as you exhale. If you can hold at the end of your exhale. Go for another 3 breaths in your own time. And from there, you're going to slowly bring your knees up so that your feet are flat on the floor. And then as we inhale, we're going to exhale and just gently move the pelvis up to the face. So in the pelvic tilt. And then inhale to just relax everything. Really feel whether you're gripping. Inhale, fully releasing. So we're tipping up towards the face, we're not lifting the bottom. Inhaling back to neutral. The breath is light and low. If you find you're holding too much tension in the knees, you can pop your knees together and this creates a nice space around the sacroiliac joint. And then just gently tilt the pelvis on the exhale. Feeling the ribs expand. We'll do another 3. Fully relaxing, allowing that blood flow around the pelvis, the lymph flowing. You're going to bring your feet back so the hip width apart and open your eyes. We're going to inhale and we're going to exhale 1 foot away, so it's a heel slide away. If that's there for you, or you can stay in the previous layer. Inhale back to center and exhale, heel slide the other foot away. Inhale, exhale away. The breath is light and low. If you really want to release tension, you can make an audible sound on your exhale. Inhale, exhale away. Inhale and exhale. Do 1 more on each side. Inhale, fully relax. Exhale away. Slight tension on the band. Inhale and exhale away. So I'd like you to bring your towel or your soft ball and place it under your sacrum. So it's in the middle of your back, a little bit lower. So it's just above the tailbone. We're going to do little circles. So we're going to inhale and circle clockwise. And then we're going to exhale and you're going to circle anti-clockwise. So we inhale, it's gentle. All the way around and then exhale. Breath is light and low. Circle around the pelvis and exhale. You may have to adjust like I did. Find your happy place. Inhale, circle, and exhale, slowly circle. Inhale to circle, full circle, and exhale, fully release. Can't quite get my ball in the right position. Inhale. Got it. And exhale. Two more. And exhale. One more complete round. Inhale. Nice and slow. And exhale. So with your ball or towel underneath, or you can take it out depending on what feels comfortable for you. We're going to take our knees in for a little hug. So we're going to inhale, bring the knees in for a little hug, and then exhale down. Fully relaxing, imagining the blood and lymph flowing. Inhale, gentle lift. Exhale down. Everything relaxed. You can pause at the end. Inhale. Exhale down. Inhale. And again, if you don't like anything under your head, just do what feels right. It may restrict you a little bit. And exhale. Inhale. You can stay here. If you choose to come along, we're going to add some arms. So as we inhale, we bring the arms overhead. So we can inhale up. And then exhale your arms down. Inhale up. Slight control, depending if you've got a ball or a towel. Exhale down. Maybe try both. Inhale overhead. Exhale down. Inhale, three more. Exhale down. Inhale. Exhale down. One more for Lux, it's so nice. Inhale up. Fully stretching overhead. And then relaxing everything down, release. Take the ball or towel away. Come onto your side. Take your towel or bolster. We're going to place it under your ribs at the side. You're going to have your head in your hands. Your knees are going to be bent. The ball. And we're going to inhale to reach over. So you're going to inhale over. Nice stretch. And just exhale and release. Inhale over. Breathing into the ribs. Exhale to release. Inhale. Reach. exhale to release. Last one like this. You can stay here or you can choose to come with me on the next one. All I want you to do is extend the leg on the exhale. So we're going to inhale over. And then as you come down with the arm, we're going to extend the leg down. Slight resistance in the band. Inhale. Relax everything. Exhale and push. Inhale. Exhale, push. Inhale, relax, switch all the muscles off. And exhale, push. Keep going. We'll do 3 more. One more layer if you want to come along. If you don't, you can choose any of the previous layers to stay in and just do what you need today. If you want to come along, we're going to bring the leg up as we inhale. So we're going to come up. Slight tension on the band. Exhale everything down. Inhale. Nice and controlled. Exhale down. Slow and relaxed. Inhale to come up. Exhale to go down. Let go. Relax the feet. Inhale. 2 more. Exhale down. Everything relaxed. Inhale, last one. And relax down. Come onto your back. I'm going to remove the bolster. So we have our band. I'm going to take the bolster under my sacrum. So you're in a supported bridge. You can stay here and just do breath work. Or you can come along. Or you can come along, raise your arms overhead. And then do a pelvic tilt as you bring the arms down on your exhale. Inhale. If that's not for you, you can just stay in your supported bridge and do the breath work. Tilting the pelvis towards the head, finding that connection. Release and relax, turning to neutral on your inhale. Everything's floppy. Slight tension as you exhale to engage the core, tilt the pelvis to the head. Three more. Do it in your own time. Relax and exhale. exhale. Last one. Again, stay in any of the previous layers. Or you can raise your knees up into a hug. So we're going to inhale, so we have our feet hip width apart. Inhale up. Exhale. And just slightly take your knees out to the side against resistance. And just inhale. Coming down to that neutral position. Inhale up. Nice and relaxed. Little hug. If you want to, you can pull your knees in. And then we're just going to exhale, slight resistance. Inhale down. Relax everything. Inhale. Oh, I've messed up my breathing. Apologies. We're going to inhale in. Gentle squeeze if that's there for you. Exhale out. And rest down. Reset. Inhale up. Gentle squeeze if that's there. Exhale out to resistance. External rotation of the hip. Gently down. Inhale in. Exhale out. Lower the legs. Full exhale. Inhale in. Last one. From here, I'd like you to do the same little hug, but this time we're going to do circles, or you can just go back to normal breath work. So inhale in, and then we're just going to circle the knees around. And your exhale. Back to neutral, everything floppy. Inhale in. Circle the other way. Inhale back to neutral. Exhale. Inhale up. Exhale your way around. Circles can be tiny, they can be big, however you want to do it. Inhale in. Exhale, circle. Relax. Inhale in. Last one. Exhale, circle. And return. Last exercise in this position. Let's do exactly the same. Inhale in. I want you to bring your knees in, and if it's there for you, we're going to extend one leg down on an exhale. Inhale in, little hug. Exhale the other leg away, reaching for the room. Inhale in. Exhale away. and slow. Inhale in. Exhale away. You can point the toe, reaching for the wall. Inhale in, little hug, and extend that leg. Do 2 more, then we're going to do the other side. So from here you can just roll over onto your other side. I'm going to turn around so you can still see me. I'm going to have my bolster under my ribs, supporting my head. Your knees will be bent. And we're just going to inhale over. Nice big stretch. Exhale down. Inhale over. Exhale down. Inhale over. 3 more. Exhale down. So choose the layer that works for you. And if you want to come along, we're going to start extending that top foot. So we come over, reach on an inhale. We exhale down and extend that top leg. Inhale. Exhale away. Inhale. Getting ahead of myself. Exhale. Inhale. Exhale. 2 more. Exhale. Inhale up. And exhale. If you want to come along, we're going to start bringing this leg up. Inhale in. Exhale down. Try and keep that top hip rolled over. Inhale. And exhale down. Inhale. Keep going. 3 more. Last one. Make it your best. So from there, we're going to come into sitting. So I'd like you to have a slight tension on the band. So if you take your legs out to a nice comfortable place, so just slight tension on the band. If you find that you're really tight in your hamstrings, you can have the bolster underneath, and that's going to give you a bit more reach. We can have our bolster there. Just checking I'm still in the video. So you're going to inhale your way up. So we're going to come up on a big inhale. Imagine a piece of string pulling you nice and tall. And then as we exhale, I'd like you to tuck your chin to chest.
We're going to bring our arms down and just reach forward on an exhale. So you're massaging your tummy. If you want more stretch, then you can flex your feet. And then curl your way up. So we're relaxing the pelvic floor, coming all the way up through the spine. Reaching up nice and tall, looking at the wall in front of you. Exhale your way down. Curling down nice and slowly. You can pause at the end if you like the pause at the end of the exhale. Inhale to come up. Relax, no gripping the pelvic floor. Do it in your own time. See if you can get a little bit further each time. Inhale up. Exhale down. Inhale up. Do 2 more. Inhale up. And back to center. I'm just going to remove the bolster. Again, we have our legs, slight tension with the band, not too much. All I want you to do is take your arms out wide. Take a big inhale. And then we're going to twist around and see if you can kind of reach for your feet. It's very easy for me because I'm pretty short. But just go where it feels comfortable for you. So that's our exhale. We're going to inhale, center. Arms out nice and wide for a chest expansion. You can have your feet loose or you can flex them if you want a deeper stretch. And then we exhale our way around and then reach. Coming back to center. Big inhale. Exhale your way around. Keep going. Inhale. Exhale, release. Inhale. Last one. It's actually a very good workout for the legs, isn't it? Inhale and relax. Okay, so coming down onto your back. We're going to finish the nice inhale. You can take one leg down and then your other leg is going to roll over. And we're just going to stay here, have a couple of breaths. Your head is going to rotate to the opposite arm.
try and relax your legs with the band on. Coming back on an inhale. Take the other leg down, the top leg over. Just relax. Coming back to center. This time, I'm going to take that top leg over, roll over, and we're going to take your top arm to follow. And you're going to inhale, try and reach that top hand as far to the wall as you can. And then you're going to exhale and open the book. Don't need to take our arms out too far. We're going to look over towards your hand. Couple of breaths. Coming back. Do that one more time. So we're going to inhale. Reach. And then exhale our way over. Couple of breaths. And do the other side. So back to center. Inhale. Take that top leg over. Oh, I'm not going to have enough room. Sorry. I'm going to do exactly the same. So you're inhaling and reaching. And you're going to exhale your way over. Couple of breaths here. Inhale your way back and reach. And then exhale and open the book. Coming onto your back. I'm going to take off the band. To rub your hands together. You can do this on your skin, or you can do it through clothing. We're just trying to generate some heat to again just relax the tension and any pain that you've had in the pelvic area. Just breathing in to finish. So the lymph, pretty much all of it is on the front of your body. And if you think in terms of your stomach, you have the cisterna that comes down to the stomach. You have so many lymph nodes here. And we want them to be working optimally. You have a huge amount around the belly button, so it'd be a really nice idea to gently massaged around the belly button. You could imagine a sunflower and just gently stroke the petals of the sunflower. Lymph is quite close to the surface of the skin, or the superficial lymph is. You do have deep lymph nodes as well. So the massage needs to be gentle so that you don't collapse the lymph. Exercise really helps with deep lymph. Gentle massage is how we kind of stimulate superficial lymph. I do have a blog on my website with a video as well of how to do home care for the lymphatic system, and lots of information on how to support it if you want to have a read. Just gently massage. And again, for those who suffer with pelvic pain, come down and just massage around. Heat and cupping are really good. And I also have a myofascial vibrating ball as well that I will sit on my sacrum sometimes for a couple of minutes and then roll it around my stomach and pelvic area. I think I've got several links in my videos for that one. I'll leave it there. So I hope you enjoyed the video.